Esteemed viewers, good day and welcome to Medicine Focus. As always, Medicine Focus is a channel that looks into the different classes of medications that are being used in the management of different pathological conditions. Today, Medicine Focus is going to focus on antibiotics. That is medications that are being used in the management or treatment of diseases or conditions being caused as a result of bacteria. So antibiotics or antibacterials are agents that are used to fight bacterial infections. That's why without functioning antibiotics, common infections such as cellulitis, ear infections, otitis media, chest infections will have become more serious, meaning minor conditions being caused by bacteria will have become more serious and life-threatening, if not because of antibiotics. Antibiotics mode of action is of two types, specifically bacteriostatic and bactericidal. Bacteriostatic in the sense that it inhibits or prevents bacterial growth so that activities within the cell of bacteria cannot take place, meaning those contents, those protein factors that constitute the bacteria's growth and well-being will not happen. As a result, growth in this bacteria doesn't take place. So, part of now bactericidal. Bactericidal mode of action, it totally eliminates the bacteria or kills the bacteria totally, which is a term we refer to as bactericidal. So there are main targets or goals of antibiotics in this bacteria. So what are those targets of antibiotics? First, the cell wall or membranes that surrounds the bacterial cell. Secondly, the constituents of nucleic acid, that is DNA and RNA. And finally, the machinery that produces protein, which is ribosome and associated proteins. So have we now known this? Let's look at the different classes of antibiotics. Antibiotics are of different classes. There are many classes of antibiotics, but the size of our package on Medicine Focus consists of only 10 antibiotics. Have brought about only 10 antibiotics, although there are more than that, but we specifically cornered our attention on these 10 antibiotics. And as we move further, we are gonna bring you or take you through the remaining ones because antibiotics have many. But as of now, we have brought about 10. We have looked into 10 different classes of those antibiotics. First, we have the aminoglycosides. Aminoglycosides, they are protein synthesis inhibitors in the sense that they bind to the 30th subunit of the ribosome, thereby disrupting protein synthesis. And as a result of disrupting protein synthesis, bacterial growth, synthesis of this protein that stimulates the growth of this bacteria is being disrupted. So as a result, bacterial growth will not take place. So this mode of action is bacteriostatic. And the reason why this 30th subunit, by binding to this 30th subunit only affect bacteria is because humans ribosomes is made up of 40th and 60th subunits. So that's why humans are not being affected by this. So only bacteria is being affected by this. So examples of aminoglycosides are the gentamicin, neomycin, amikacin, streptomycin, and many other classes. So another class is the cephalosporins. Cephalosporins are bacterial cell wall inhibitors. So their mode of action, they are bactericidal. So cephalosporins, they work by binding and inhibiting penicillin binding proteins. And penicillin binding proteins facilitate the synthesis of peptidoglycan. And peptidoglycan is a major component of bacterial cell wall that helps in the maintenance of this bacterial cell wall. So, disrupted cell wall allows the influx of water into the cell of bacteria, thereby resulting in cellitis, that is, spilling out of the cell contents. As a result of the spilling out of those cell contents, the bacteria dies off. Why? Because peptidoglycan is being inhibited. So, cephalosporins is referred to as beta-lactam antibiotics. Why? Because they have beta-lactams in their rings. Examples of the cephalosporins are the first generation such as cefazolin, cefalezin, a second generation such as cefazotin, cefaclo, cefrozin, and third generation such as ceftriaxone, cefotazine, ceftazidine, and many others. We also have fourth generation, even fifth generation. So some side effects associated with this are gastrointestinal upset, hypersensitivity to penicillin. Another class is the tetracyclines. Tetracyclines are protein synthesis inhibitors. By binding, just like aminoglycosides, by binding to the tartrate subunit of this bacterial ribosome. Examples of tetracycline: aminocycline, democlocycline, doxycycline, and many others. They are being used specifically in the treatment of sexually transmitted infections such as pelvic inflammatory diseases and many others. Another class is the penicillins. Penicillins are beta-lactam antibiotics. And I said why? Because they have beta-lactams in their rings. So, they are bacterial cell wall inhibitors. Those are cephalosporins. Examples of penicillins are phenoxymethyl penicillin, benzyl penicillin, amoxicillin, flucloxacillin, tazocin, and many others. So, one prominent side effect is gastrointestinal upset. Another class is the sulfonamides. Sulfonamides are bacteriostatic. They inhibit the synthesis of folate or folic acid. Bacteria have the ability to generate their own folate. Therefore, sulfonamides act on this unique bacterial function by inhibiting folate synthesis. Examples of the sulfonamides are the sulfametazole, sulfazoxalone, sulfadiazine, and many others. They have been used in infections such as burns, eye infections, urinary tract infections. Some possible side effects include skin rashes, gastrointestinal upset, hyperkalemia. Another class, which is the sixth class, is the fluoroquinolones or quinolones. Quinolones inhibit bacterial DNA duplication through inhibition of topoisomeresis, which interfere with DNA unwinding and therefore transcription and translation. Examples of quinolones are ciprofloxacin, ofloxacin, levofloxacin. And one prominent side effect is gastrointestinal upset. The seventh class are macrolides. Macrolides are protein synthesis inhibitors, but unlike tetracyclines and aminoglycosides, they bind to 58 subunits instead of 30 subunits of the ribosome, and they are being used in the management of bacterial infections such as pneumonia, sinusitis, ear, nose, and throat infections, H. pylori eradication particularly. So they prevent ribosomal translocation and therefore protein elongation by binding to the 50th subunit. Erythromycin, azithromycin are some of the examples of these macrolides. And some possible side effects are gastrointestinal upset or toxicity. In the eighth class is the carbapenems. Carbapenems There are also bacterial cell wall inhibitors. Examples of these carbapenems are the meropenem, doripenem, ertapenem, and many others. They are broad spectrum antibiotics and can be used for urinary tract infections, abdominal infections, among others. The ninth class is the lincosamides. Lincosamides, they are protein synthesis inhibitors also, and they work by specifically targeting the 50th subunit of the bacterial ribosome, just as macrolides. It can be used for skin infections, burns, lung infections, among others. Examples of lincosamides are clindamycin, lincomycin, polymycin, and many others. And the final class, the 10th class, is the glycopeptides. Similar, but quite different to penicillins. Glycopeptides prevent the formation of cross-links in the peptidoglycan cell wall, while penicillins increasingly and competitively inhibit transpeptidase. Glycopeptides bind to the proteins in the cell wall themselves to prevent transpeptidase from binding. One example is the erucolanin. So that's the size of our package of antibiotics as of now. Like I said earlier, there are many other classes coming your way. Just stay tuned to Medicine Focus for more. If you enjoyed this video, don't forget to subscribe, drop your comment so that you can get more from Medicine Focus. Have a nice day.